Madam Deputy Speaker. I think most people understood that vaccination was the route back to normality. And despite the fact that 95% of adults in the UK now have antibodies, and I accept that there may be some reduction in protection in antibodies, but there's certainly no evidence that there's any reduction in T-cell protection, despite that enormous antibody coverage, we're being asked to impose more restrictions on lives and livelihoods. Now, I've looked in detail at the London School of Hygiene and Tropical Medicine's modelling, and I think we need to be clear that these are models, as my honourable friend has just said, not forecasts or predictions, and they're based on some pretty major assumptions, such as Omicron has the same severity of disease as Delta, the length of hospital stay, etc. is the same. And these assumptions are becoming more and more out of date by the day. So there's no known benefit to the measures that we're trying to implement today, but there will be inevitable harms. Working from home, we've seen last week research that suggests that those working from home are 11 times more likely to experience domestic abuse. Masks sounds innocuous in their own right, but the signal it has sent and is sending across all of society, including schools, is to panic, is to fear. And we're seeing schools closing already today and saying that they may not return in the new year. And the 100,000 ghost children that have not returned to school since lockdown should be a warning to us of the unintended consequences of potentially small measures. On vaccine passports, I can't support that. I think, as my honourable friend Veronique said, I think it's discriminatory, I think it segregates people. And we have a proud tradition in this country of standing up for minority views, even when we don't believe them ourselves. And I think in the rush to get jabs in arms, we shouldn't throw that tolerance and that respect to the wind. And on the mandatory vaccination of NHS staff, I completely agree with my honourable friend from East Worthing. I don't think this is about the ideology of whether people should or not be vaccinated. It's about the pragmatic reality that we will lose tens of thousands of staff at a time when we can least afford it. But I think this is no longer really a debate about whether masks work and who should have a vaccine and not. It's really about who are we? What kind of society are we creating for our children? Do we really care about the freedoms that we all took for granted before 2020? Now, I know people roll their eyes when Conservatives and Libertarians start talking about civil liberties and freedoms. But freedom is not an abstract ideology. Freedom is what enables my constituents to see their family, to comfort the dying, to go to school, to go to work. That is what freedom looks like. And after 20 months of in-out restrictions, we have to accept there has been a permanent change to the understanding of what liberty is in this country. That's why I can't support these measures. And I urge the government return to a society of freedom and responsibility. Our constituents deserve it, and they will rise to the challenge.